everybody to our informational webinar. My name is Leanne Swanson. I'm the CEO of the National Center for Healthcare Leadership. Happy Monday, everybody. I hope you all had a nice weekend and are staying cool wherever you are in the country. So we are proud to present this webinar in collaboration with our partners at Emeritus, and my colleague David McDonald is going to do the majority of this presentation to share with you an exciting partnership we've developed with them to bring our members, our NCHL members, some professional education opportunities. And this opportunity then will partner with the top tier universities that Emeritus partners with. So David will be explaining all of that, but we have several partnership programs that we're offering a discounted member rate to our members. And then the exciting part of that is if you choose to participate, we have developed a special 6-part thought leadership series that is in addition to the existing program. So it's sort of an added bonus as a special component to the program that we are offering in partnership with Emeritus. So I am going to turn it over to David McDonald, who's the Vice President of Healthcare at Emeritus, and he's going to walk us through what the programs entail, how you go about finding out more information, and then we will have some time if you want to chat any questions in the chat box, or I think that's how we're going to do it. We are recording the call, so if you or your colleagues weren't available, if you know your colleagues wanted to attend but weren't available, this will be posted on our website and made available to listen at a later time, and hopefully this will be provide you some information for this program. And you can also contact David, which I'm sure he will tell you how to do that as a follow-up to the webinar. So David, I'm going to turn it over to you, and we'll come back at the end if there are any questions.
Thank you, Leanne, and happy Monday to everyone. Again, my name is David McDonald, and I'm the Vice President for Healthcare here at Emeritus. And if you're not familiar, just in a sentence, Emeritus is the world's foremost provider in online professional education. And we have learners from over 80 different countries and enroll over 100,000 unique students each year. The program that we're going to talk about today is a new collaboration between Emeritus and NCHL. Working with Leanne, we have curated 3 different feature programs that I'm going to talk about here, and also the Thought Leadership series. And as Leanne said, at the end, I'll go through the enrollment process with you, and there'll be plenty of time for questions and answers. And so if anyone has any questions at all, I really would welcome the opportunity to answer those. So the 3 featured programs, starting at the top, are the Chief Medical Officer program from Emory Healthcare and Emory University. And it begins on September the 18th, and it runs between 9 and 12 months. And you'll notice right off the bat, we have the list pricing and then the special NCHL member discount fees listed below. And with each of these programs, you also have access, as I said, to the Thought Leadership series. The second course we're going to talk about is the Johns Hopkins Business School Business of Healthcare Driving Impact and Transformation program. And this has been wildly popular so far. We just put this together a few months ago after a very long developmental process. It's really exciting as well. It begins on September the 26th. It's a 4-month-long program, and again, with access to the Thought Leadership series. And the third program I'm going to talk about is the University of California at Irvine Chief Nursing Officer program. It begins on September the 23rd, and it runs between 5 and 6 months. Again, Thought Leadership program. And the 6 different components of the Thought Leadership series are listed over on the right. These can be changed a little bit, perhaps coming out based on demand, but this is what we're working with. And we have sourced expert faculty from top universities all around the country, focusing on healthcare and business as well. Point is, they're all driven very much at helping clinical and business leadership people in a healthcare setting grasp the latest topics and concerns that we face as an industry today. The first program, as I said, we're going to talk about is the UCI Chief Nursing Officer Program. And what the course is really designed for, or who it's really designed for, and there are a couple of our requirements. It's generally expected that a candidate wanting to take the program would have 10 years of experience in nursing and management roles combined, and also has with all of these to be fluent in written and oral English comprehension, the English language. And it's designed for specifically executives, whether they're CNOs already wanting to expand their knowledge base, or they're aspiring to be CNOs and they're nursing professionals who are preparing for the challenges of the C-suite. And then, of course, senior nursing leaders who are wanting to upskill themselves into their future roles and extend their knowledge base. A quick overview of this course is, as I said, it's designed for current and aspiring nursing executives, and really to provide the next generation of nursing leaders through the leadership teachings of the program, and providing a strong approach, as it says here, to tackling the challenges with the healthcare systems today. And what we have seen, especially over the last few years, is with the continued shortage of nurses, we've also seen a shortage of nursing leaders, and hospitals and health systems in particular are greatly challenged by finding CNOs to fill roles. And the solution presented here in part is giving the skills to current senior and director level candidates within a health system already, so that they can organically fill CNO roles, and then also have a deep and broad bench of candidates for future opportunities. Content is focusing on a range of very relevant topics, including innovation, hands-on coaching with staff, workforce development, and then certainly dealing with technological advancements as well. And the really big key here too, and I'm going to read one note for you, is that, actually let me go here, is really giving the confidence to your staff to make effective decisions, and giving the CNOs and future CNOs the ability to recruit, develop, and retain high level and high performing teams. So that's kind of the UCI Nursing Officer Program overall. And again, when we finish, I'll be happy to answer any questions anyone has, or go into great detail about the content, how it works, and the different modules. But with all of these programs, it's a very complex, very robust offering, and includes a capstone project at the end of the program, or actually throughout the program, that's then presented at the end. And the capstone project, along with an assigned academic support person and mentor, is designed to really help a learner combine a particular project that they may already be having in their day-to-day work life, and use that as a catalyst for a full-blown learning opportunity here, and then to be able to present back to leadership at the organization from which they came from their capstone project. So that's really an exciting component of all three of these courses. The next one I'm going to talk about is the Johns Hopkins Business of Healthcare program, Driving Impact and Transformation. And again, it starts on September the 26th. And with all of these guys, the start dates are in September, but the enrollment deadlines are in August, and we actually can still push those, but the idea of going through the entire application process, which is very simple, and I'll help you with that personally. We want to get that all lined up next month, if at all possible. And this program is designed for, again, experienced healthcare professionals who are in a leadership role and aspiring to be in a leadership role with the full-blown knowledge and really the business skills to lead healthcare organizations in today's most challenging environment. And I've been in healthcare working with hospitals and health systems for the past 28 years, and I've never seen anything like the the continuing difficulties, but yet the new opportunities to address those difficulties that are now present, not only through advancing technology, but also through different ways of doing things and better understanding of the grasp of the concepts of healthcare leadership. And this course is designed specifically to address all of that. It's designed specifically for new and emerging non-clinical and clinical leaders, all executives and C-level officers at healthcare organizations, and the department heads, or the functional heads rather, of each different sector within the organization. And that could be anything ranging from quality through patient safety, through medical affairs, through marketing even, and then certainly all of the finance folks, and then again, senior clinical leadership. And we often hear that from clinical leadership in particular, and all three of these courses handle this in a different way, but all are addressing this, that many times the actual business skills or the business education is not present. And so learners are constantly wanting to seek that component as well. And the course here at Hopkins is actually broken up into a few different groups of modules taught by various different faculty members with expertise in a very specific area. So it's not just one kind of a one-size-fits-all approach. It's actually multifaceted to handle all of the different challenges that we're seeing in the industry today. And just a quick overview of the course, kind of how it's broken out, is that it has an overview here. It's designed to help instruct on building and managing diverse healthcare teams, improving leadership and strategic decision-making skills, and again, to address the more complex than ever healthcare setting that we're currently existing in. Understanding the intricacies of healthcare operations, including supply chain management, quality control, and finance, fostering a culture of resilience to promote adaptability and certainly mental well-being. And that's a huge focus as well, mental well-being in the workplace and in healthcare. As we all know, that's a very critical piece as burnout has become rampant. Then exploring techniques for improving equity and accessibility within healthcare. And at the bottom, this has just been huge, just over the last several months of not only excitement, but now completion with courses just aimed at artificial intelligence and digital transformation and innovation. Those topics have been not only wildly popular, but also have had a tremendous impact talking with learners who have taken those types of courses. And Johns Hopkins here has a complete component of that as well. Third program we're going to talk about, or I'm going to talk about, we're going to talk about when we're finished, is the Chief Medical Officer program from Emory. And it's designed for physician leaders that are in management positions and who, kind of as I spoke about the nurses a minute ago, also those that aspire to be in those positions. And it's designed to help not only a health system or a hospital to be able to fill a particular CMO role, but also to create a bench of potential candidates for in the future and really raise the knowledge of the entire medical leadership staff overall. And again, focusing on the business strategy for healthcare organizations. And it's designed for CMOs who who have been there for 5 years or less that are really wishing to better understand the challenges of management and how to address those challenges to be successful leaders in the healthcare industry. And requirements are certainly that a medical degree is required, and then I believe it's 10 years of experience in a medical leadership role. The overall components of the course are, again, and this one also, like the other ones, has a capstone project that goes along with your learning across over the 9 to 12 months, and again designed to help solve a problem that you may be facing, at your particular organization already. And it's an immersive learning journey, as it says here, and focusing on providing the skills and framework and mindset required to succeed as a chief medical officer, not only with clinical operations and how to oversee those things. Many times we see clinical leaders that have a 2 or 3 days a week where they're seeing cases, but also having to face the challenges of the leadership component. And then again, as often are expressed to me, that they feel that they lack the business understanding. So being able to pull all of that stuff together to really provide them with strong, not only knowledge, but confidence in that knowledge and ability to leverage that knowledge in a leadership position, and certainly to influence stakeholders and drive quality and safety as well, which, as we all know, are the hottest topics in healthcare today. And with reimbursement rates continuing to be greatly affected by quality improvement, having a thorough understanding of not only the clinical nature of quality, but also the business nature of quality and the impact that those scores have, not just from looking at CMS reimbursement, but also in recruiting and retaining physicians and reaching out into the community, and even leveraging quality scores to attract business relationships with large self-funded employers here in the United States. So those are the 3 programs. And this is how one enrolls. Is you have your emails coming from NCHL already, that and also on the NCHL website that gives a brief overview of all of the content. And there's a link there right at the top of the page here, nchl.enterprise.emeritus.com. After the meeting, I'm also going to make sure that each of you today has an email from me with this link as well, and you can bookmark it and save it. But simply you will click on that link, and it'll take you right to the page that I've highlighted here on the right. And you just click Explore Courses, and it'll bring these three programs up. And we're also going to be adding some additional courses here as well in the near future. I'm looking at some different facets of healthcare that are very exciting too. And so you can click Explore Courses and then simply select the course that's of interest to you. And there's a button where it says Request Enrollment. And so it will ask you for your name, your title, how long you've been there, your organization, just basic information like that. And then once you click Request Enrollment, an email actually comes to me and another member of my team. And then we will quickly review that. And then you'll get an email back from the system that will contain all of the next steps, including verification that you've been approved, and then some different options for how you can actually pay for the course. And those things include, we can discuss and explore, is there reimbursement? Is there a reimbursement opportunity from the organization? Do you want to defer payment across several months? How all of that works. And that's really the beauty of the way that we've designed this with NCHL, is to keep it really super simple for you. And as was already discussed, members will receive a 15% discount on any of these programs. And there are also additional discounts available for group and team enrollments. And what I mean by that is, if you've got 7 or 8 colleagues, or if you're a larger health system, and I work with several larger health systems on constructing these types of arrangements right now, where if we pull in a larger number of learners, we can certainly explore deeper discounts for the organization as well. This email here, healthcare.team@emeritus.org, goes directly to me, and I'll also share my personal email with you and my phone number as well, if there are any questions that come up at any time, or anything else that you may want to know. And that is it from me, and I'll turn it back over now to or actually, I'll open it up now. And I guess Leanne would have the questions if they're being asked. Do you see those?
Yeah, I think Megan might be able to. Yeah.
Okay.
Go ahead.
We don't have any questions right now.
Okay.
So if there are questions.
I think, David, you mentioned, thank you, David, for presenting the overview, and I'm hoping that our members are interested. And again, I know some of you might be on or listening to this, and you might not be the person, but can think of a colleague who might be interested, or that type of thing. I think we're open to, these are the three programs that we, Emeritus and NCHL, in our communications, decided were the three programs that we wanted to test this partnership out, if you will, but definitely would be open to hearing from our members for any future programs that Emeritus does already offer. If there are, other professional education programs, please reach out to myself or David. And if it's a program that Emeritus already works with some of these, again, top echelon of universities and academia, then we can certainly explore that. And I think the key again is this thought leadership series that is an added bonus that most people who go through these programs, a regular program, would not have that additional thought leadership series. So we are trying to make this as beneficial to our members as possible.
Correct. And I'll touch on that again, just very briefly. In the thought leadership series, it's really broken into 6 different unique leadership discussions from different industry experts. And there's driving accountability and workforce management, international staffing solution for the nursing shortage. Then there's augmented reality for medical training, artificial intelligence in healthcare, and then crisis management and communication. It's a how-to. And then also clinician upscaling to optimize virtual care as well. So those are all 3, or all 6 rather, unique, and you have access to those when you take one of these courses. And let me say one more thing about the courses too. The way the learning is done is there's regular office hours, and we can go into all this stuff on an individual basis, but there's regular office hours available to you from staff. You're dealing with an academic support person, an advisor to help you with your capstone projects. And you're primarily in an asynchronous environment, meaning that it goes at your own pace. It's not that you have to be somewhere at any particular time. So these courses and a lot of the success that is achieved is the way that they're designed to fit into your day-to-day work life. So thank you for bringing that up too, Leanne. Mm-hmm.
I do see a question. Hi, Tara. The audience range seems wide for the Johns Hopkins Business of Healthcare new leaders, functional leaders to executives. Since the audience is so varied, what would you say is the level of content is?
Yeah, no, that's an absolutely great question. And the audience is varied, and the level of content is particular with this course and with most offerings from Emeritus. Each module will begin at a high level situation and then go very, very deep. And then some components will be more acutely aimed at something that you may, particular Tara, be working on specifically, but other components might not be directly related to your day-to-day work. However, the knowledge base will be critical for having any types of high-level business discussions and understanding what other members of your team are talking about when you're having a for example, a group ELT meeting, and we're talking about quality, and then we're talking about marketing, and then we're talking about driving more business, and then we're talking about the business case for selecting an EMR, whatever those things may be. So it's really kind of a two-pronged answer. A, it's very high level so that you get a broad understanding of all of the different areas, but at the same time, it will go very, very deep into each of those silos. Does that answer your question? I would guess.
Yes.
Thank you.
All
And
right.
I do
Go ahead, David.
one more thing there too is with there being regular office hours each week, if there's a particular component of a course that you want to get very deep into with your instructor, that's certainly available, to have those types of conversations, and also to network with your colleagues about how they're addressing particular issues for you as well.
All right. David, could you flip through the slides to that email again? I don't see any more questions, but I wanted to make sure we had it so that they know where to reach you. Thank you. And then we also, Megan put in the chat the link to the NCHL website. So you can always go directly to our website under nchl.org, and then it's under programs and emerging professional education programs. I'm trying to picture our website right now. So there's a few ways you can contact us if you do have questions following this presentation and want to learn more. But David, I want to thank you so much for your time. I want to thank you and Reneel and Emeritus for bringing this opportunity and partnering with NCHL to bring this to our members, this professional education opportunity to our members, and look forward to hearing any questions or receiving any feedback for future ideas on additional programs that you'd like to see us offer. So thank you all so much. Enjoy the rest of your day. I hope you all have a great week. Thanks,
Thank you,
David.
everyone.
Thanks, David.
Thank you, guys. Have a great week.